right moment to proceed, but it's absolutely vital that we proceed with caution. But what does proceeding with caution actually mean? Let's speak now to Professor Paul Dolan, behavioural psychologist at the London School of Economics and host of the very popular Duck Rabbit podcast. Hi, Paul. Great to have you on the show.
Hello, Mark. Lovely to be on with you.
And I
wonderful
can stress
to have the same surname.
Well, we do. No nepotism at play here.
No, we are not in the same family. Let's be absolutely clear with everybody.
We actually had the DNA test and I was devastated to find out we're not related, which means I don't share your rather ingenious genetic makeup. Let's talk about the idea. It's an astonishing concept, isn't it, Paul? The idea of sort of stepping into freedom cautiously. It seems that the government's messaging yesterday was very vague. It was very equivocal, perhaps deliberately so.
Yeah, it's it's all very confusing, isn't it? And I think, you know, we've had 16 months of being scared. We've had 16 months of daily reports of hospitalizations and deaths, but increasingly cases. You notice how now it's just the case numbers that we hear, and as a sort of PS, it's the number of deaths and hospitalizations. And it's very hard to get out of that that narrative, I suppose it becomes around cases. And so it's not surprising, I guess, in one sense, that the case numbers then become the prominent means by which particular concerns about the virus are communicated to us. And one of the things I think we should do on Freedom Day, although, as you say, it's increasingly becoming a very not a very clear term what that means on the 19th of July, is to actually stop presenting the daily cases.
We've had that debate on this show because, as you have said, you know, cases do not directly equate to hospitalizations and deaths, not in the same way that a case of hepatitis might cause concern.
No, and not also, and also not in the same way as they might have done earlier on before we vaccinated. Now, what, 2/3 of the population as we speak have been vaccinated? Of course, that's not a randomly chosen 2/3. That's most of the vulnerable people at risk from the virus. So, you know, I think there's something really important about the social contract in all of this. And it's not just the social contract between individuals and the state, in that we've all done many of the measures that have been asked of us for a very long time in order to wait for the point at which vaccines have been administered to the vulnerable populations, double doses, for us to then be allowed back out again. So we've done our bit. So now it feels like, you know, the government should be doing theirs. Also, secondly, the social contract that exists between different groups in society. I think that's really important, that we paid a lot of attention. I've said this, you know, I've said this many times before about we've focused on the splash of the interventions, looking at the hospitalizations, the deaths and the cases, but not the ripple effects downstream. And all of those that have experienced the adverse effects of those ripples, the loneliness, the mental health problems, the school kids that are still wearing masks, by the way, in you know, all day in school, it's time for their part of the social contract to be honoured. You know, I do find it's interesting about masks. You hear a lot of people saying it's only a mask, it's just a mask. Well, that does depend on context. That does depend on context. And, you know, if you're a kid in a classroom wearing a mask all day in school, it's not just a mask, I don't think. We haven't really had any proper inquiry into any of the mental health effects that might be caused by children wearing masks in school, where, from what I can understand about the transmission risk, they're very, very small in the classroom when the kids are in their bubbles anyway.
There's an argument, Paul, that everybody is exempt from wearing masks because unless you actually enjoy wearing them, by definition, they cause discomfort or distress. And I don't know too many people that actually enjoy wearing a mask, actively enjoy it.
Well, that's interesting in two ways. First of all, what you highlight is that there will always be a trade-off between different attributes of social value. I mean, I'm trained in economics, so you kind of expect me to say that we're going to be making trade-offs. What we haven't done is we haven't drawn very much attention to some of the costs that people have been asked to bear in order, and not just the discomfort, but the fact that we're not really been allowed. I've had to be sort of embarrassed to say that actually part of the human condition is to experience joy. Is to experience social contract, is, you know, to plan things, to have spontaneity, to have fun. All of these things are fundamental elements of what it means to be human. And yet we haven't been allowed to kind of discuss that in any meaningful way over the past, 16 months,
And
have we?
you, of course, Paul, are a far greater expert than I am on the makeup of human nature. But certainly from calls I've taken to this show, what seems to really get a lot of my listeners down is not temporary pain and suffering and privation. It's the idea that this never ends. And what's worrying now is the notion that, as you say, that social contract doesn't come to an end. It's not torn up. There isn't that reward for having done our bit, and that this goes on forever, which many people fear is now the case.
Yeah, I think we had a very powerful narrative at the beginning to preserve life. That's a very, very dominant, strong position. Actually, of course, when you're preserving life in one environment with a splash, you're causing significant costs downstream for lives and for people's life expectancies and life experiences elsewhere.
Yeah.
But leaving that to one side, leaving that very important point to one side, we've morphed that narrative from preserving life into preventing illness. And I, which is why I'm worried, I think, frankly, because if you said to me 16 months ago, we would be considering restrictions in the winter because of hospitalizations, largely amongst young people, of course, not entirely, who spend a very short period of time when they're in hospital.
Yep.
I would have said, well, don't be mad. We're not going to be, no one's willing to engage in significant restrictions to their freedoms in order to meet ICU capacities. But by the way, every single year, if you read any headlines any year, we've always got a problem with ICU beds.
Correct.
That's
I think we have, Paul, 25% of the ICU capacity of Germany.
Yeah. So there you go. Perfect. Wonderful stat, Mark. So why not focus our attention and effort on increasing ICU beds? Very, very clear and obvious thing for us to do. But we're also going to be managing that those beds anyway, aren't we? You wouldn't want it's a really difficult balance to strike, isn't it? You wouldn't want there to always be 50% ICU beds empty because it means we wouldn't be using that resource wisely.
The NHS, Paul, if the NHS is designed to run close to capacity, that's the business model of the NHS, and it has been for decades.
Right. So, see, these are the kinds of grown-up conversations, Mark, that we haven't been able to have, and I feel worried that we still can't have them. I mean, now's the time. There was a time early on when we should have been having this. We should have been having these sorts of conversations for 16 months. But the fact that we've just had a dominant narrative around,
and supposedly being very caring and socially distancing and worrying about COVID, and others who want freedom because they've waited 16 months for it. Is this a possible deliberate policy of divide and rule by the government, that the legal mandate goes and now we just have to fight among ourselves like rats in a sack?
Well, I wouldn't want to comment on the motivations of the government with this. I do think you're right about the polarization. I mean, I was going to say that a bit earlier. It was the other point that I was going to mention around masks. I do think there is a significant benefit that comes to many people wearing them, that you can signal how much you take this virus seriously. I think there is actually quite a significant benefit that comes to signaling. We all want to signal that we're good people. We all find various ways to do that. You do it, I do it. So that's actually a relatively easy way for people to signal that they care about other people's health. And I worry that we're kind of creating this narrative that if you don't wear a mask, you're selfish, right? I mean, that's just
whereas it could be that if you don't wear a mask, either it causes you distress or you've read the data and you're not convinced it makes a blind bit of difference.
Well, that's an interesting one, isn't it? I mean, the evidence on masks is nowhere near as strong as the case made for it. I think there may be. I mean, again, I'm speaking outside of my areas of expertise. I wouldn't make a claim that masks don't work, but I do think you're absolutely right that they're nowhere near as effective as is made to be the case, as is made out to be the case. And I do think it's a signal. There is important signaling going on. It's a signal that, as I say, about how much we care. And we're just in this position. The reason I'm not optimistic, I'm generally an optimistic person. The reason I'm not optimistic moving forward is that we've spent 16 months boiling the frog, right? We put the frog in the water. We've turned the temperature up and up and up and up and up to the point at which now, preventing illness is a legitimate reason to restrict the freedoms and liberties of millions of people. 16 months ago, you could never have dropped that frog into that boiling water. It would have jumped straight out again. People would have said, this is not an acceptable place for us to be in. So when we get into winter, I am really concerned that we're going to be putting in place measures that would never have been considered acceptable even a year ago, let alone any more time before that.
And that's why perhaps Dr. Gary Sidley, who I spoke to earlier, is right when he says we have a small window of opportunity in England from Monday to seize freedom and get back to the old normal so that the public get a taste for it again and we get some perspective and begin to realise the price we've paid.
Yeah, I do think, I mean, it's a really interesting question for academics and for policymakers and for the public too, around, the degree to which lots of people have quite enjoyed this last 16 months. I think we need to really recognise that, appreciate that, understand it, and get behind it a bit more. I mean, of course, people like me, frankly, financially, have done very well out of this last 16 months. Actually, people like me have been the ones making the decisions and the advising on them. I think that's something that we need to really consider. Yeah. I can work from home with a nice salary, pension, and actually quite a nice house. Many other people can't. But I do think that there is a sense in which some people like being told what to do, and actually like the fact that other people are being told what to do, and like the fact that other people can't do very much. Because if you're someone who doesn't really want to do very much yourself, that's actually quite a nice place to be in. So I think we need to have a really serious conversation about the benefits that come to significant numbers of people from lockdowns. And I think that's a really interesting question, maybe for some other time.
A lot of people think that if there had been no furlough, the pandemic would have ended a long time ago. Well, certainly COVID restrictions, Paul. Your podcast is incredible. It is my #1 podcast this year. It's called Duck Rabbit. Check it out. Paul with insightful interviews with some of the good and the great of the science and political and artistic community. Duck Rabbit podcast. Check it out. Professor Paul Dolan